But to begin with, just a recognition that the foundation is different. Caring for Denver really approached how we do evaluation differently. I've been an evaluator for a long time, almost 2 decades, and this was a really nice opportunity to try to do things differently, where we could really put community first in how we approach evaluation, and that's what we hope to do. So we spent about 1.5 years working with community, both just the community and general community at large through events that we have with the community, through experts in the field, and through our first year of funding with grantees, our first round of funding, to just start to identify what is it going to take to be successful at addressing mental health and substance misuse in Denver? Like, what is really the charge of the foundation? And essentially across all the data points and everything we pulled together, what we heard is that if Denver is really going to be strong and sustainable in how we are addressing and impacting mental health and substance misuse, there's really three things we need to be better at. The first one is access. So that is essentially, we need to make sure that people can get the kind of care they need, when they need it, how they need it, and in the places that make sense to them, at the time that makes sense to them, that a clinical approach and kind of a 9-to-5 office setting isn't going to work for everyone. And we need to be aware of that and really be inclusive in how we think about access. The second piece was, if we're going to be successful, we have to think about fit. And this was really kind of a cultural piece as well, that people want to get care from people who look like them, who come from their communities, who know and understand their backgrounds and can relate in a way that really can help to provide high quality care. And not only that, that there's a connection with community, but that the care providers themselves, both formal and informal care providers, they have what they need to be well and healthy so that they can provide really strong and sustainable care for the people that they're connected to. And then the last piece we heard was care over time, which is substance misuse and mental health are lifelong journeys, and people sometimes need more help, sometimes they need less help. But during those transition times, when they either need a little more or need a little less, that's typically when we lose people. They drop out of the system, we aren't able to connect, and that we really have to strengthen those nets through the transition periods if we're going to do well. So those three things are what we're starting to talk with grantees about and look for in grantees' work as a way to say, yes, we are doing what the community has told us needs to happen, and holding the foundation accountable to that so that we truly can have a strong impact on mental health and substance misuse. So we were able to take that information, we went back to that data and said, okay, this is what the community has said we need to be doing. How will we know if we're actually making progress? What does the community want to see from our grantees that would tell them we're on track? And so we pulled all that data together and essentially created what we call the shared impact plan, which hopefully you all can see on the screen now. Does this look familiar? Have you all seen this? Oh, yay, good. Okay, awesome. So we just got final approval for it in January. We're rolling it out and connecting this with grantees. And from here forward, this is really what we'll be using with grantees to think about their evaluation. So essentially what it does is it just says we've got our funding areas here on the left. We fund in each of these areas. You all are in the youth space. We're looking for grantees to identify how they're addressing a change needed. So are they working in the access space, the fit space, the care over time space? You can be in you can be all three, you can be in one, you can be in two, it doesn't matter, but really where are those places in your program that connect? And then from an evaluation standpoint, the signals that we're looking for, really at the end of the day, we're looking for the ones here, these shared impact goals in yellow. That basically we're looking for programs to be able to demonstrate that they truly reduce substance misuse, or help people. We believe in a harm reduction model too, so help people with maintaining healthy relationships, whether that's sobriety or just a better maintenance and relationship with drug use. Or we're looking for programs to be able to show that they've improved mental health or maintained positive mental health. This includes addressing suicidality, harm to self, harm to others, but also just general mental health. We're looking for programs to be able to talk about increased equity and mental health and substance misuse outcomes with the people that we're working with, or particularly for our Alternatives to Jail group, looking for a reduction in entry or recidivism for people that are in the Alternatives to Jail space, have been either are at risk of or have been in the criminal justice system. And making sure that we're really treating the mental health and substance misuse challenges outside of the criminal justice system, or building better structures within the criminal justice system to get that support. So those are the things that we're truly looking for. We want to see with our grantees. We also know in our conversation earlier, sometimes we're not there yet. You might have a 3-year grant and you're just in the first year and you're trying to develop, or the work that you do is really in parallel to these kind of shared impact goals. Maybe it's a component of it, but you're not truly going to get to that final piece for a while, maybe. So that's what these signals of progress are. This third column, this is what we heard from community, that, okay, if people can't measure those goals, these are some ways that we'll know they're at least on track. We can believe that the work and support the work in this way because we know they're headed towards those goals. So these, for each one of the changes needed, access, fit, and care over time, there are essentially 4 bullet points here. They're pretty general, and that's on purpose, that they have an intent, but we really want to work with grantees for you all to decide and help us understand what would be a meaningful observation of that, what would be a meaningful measure of that for you. So we don't ever want to really dictate for grantees what they're required to measure on purpose. We want to work with you to understand what's meaningful for your program and help you define it in a way that it's useful information for you, while also being useful information and supporting us and understanding the progress of the work. So I can go through these, but before I do, I just want to stop and see if there are any questions, ask if that makes sense. Does that resonate with you all? Okay. All right, so we can look at each one of these. So for access, this is really those signals of progress. Typically, we're looking for measures of increased engagement or retention and support. So some of the ways people measure that, particularly retention, could be people who graduate from the program who come back and become alumni or mentors in the program. It might be that they are engaged in multiple programs that are offered instead of just one. And then it could also just be the number of people who are actually making it through the entire program, really seeing an increased retention and successful graduation from programs. Increased connections for help and support. This could be around referrals, but we're really interested in the outcome, what you're trying to influence, not what you do. So we don't want people to just count like, oh, we made 12 referrals. Even though that's great and we'd love to hear about it, the outcome of that would be how many of those referrals actually went through? How many people saw the therapist that you referred them to or connected to a case manager? So we're really trying to look for those outcome pieces, not just the action or the output from the work. Increased skills or awareness around addressing mental health and substance misuse. I think that's pretty clear. We see this a lot where people are just learning how to manage or learning more about prevention, those kinds of things. And then the increased resilience and ability to cope. That's really about people putting those skills and awareness into practice. So you're actually observing someone use a skill. Someone's actually reporting on their ability to show up differently in a space or use something that they've learned to make better decisions or feel better related to their mental health. And then, so any questions about those? No? Okay. Attention to fit. Again, this is really that cultural piece. And so what we typically want to see here, the signals of progress that the community talked about, was that we would actually see people, reduce disparities in engagement. And that typically is use of services by people who typically wouldn't show up and use services. Another piece is just being able to demonstrate like increased trust or better satisfaction with care, better comfort with care, feeling connected to the person that's providing resources or support. Reduce stigmas in here. We have several grantees measuring this in really interesting and creative ways, but basically that people just feel like it's okay to ask for help, that people, or it could be on the flip side, people feel like it's more okay in community to talk about having a mental health issue or see someone who uses substances differently because of the program or the intervention. And then this last piece, people providing care, able to stay engaged in their role. Again, that they really feel like they have the support they need, they have the resources they need, they feel valued, they feel like they have the skills to be able to support those that they're helping. And again, like I mentioned, this could be formal care providers like clinical providers. It can also be foster parents or just parents in general. It can be your staff, that the people who are coming into contact with the people you serve feel that they are better able to provide that care and can take care of themselves. So that's attention to fit, signals of progress. Questions, thoughts? All good? Okay. All right, and then the last one, care over time, kind of what I mentioned. These are more systems. Wait. Oh yeah, do you have a question, Andrew?
I have a question. I go first.
Yeah.
And I don't know what we'll be able to pull together, but would like quotes and stuff be helpful for this? I mean, we hired a data person and we're organizing like the numbers and that kind of stuff, but in the actual report, is that helpful? Or do you want, like, if we can get it kind of in people's own words, or?
Yeah, we love that. Sure. There in the report itself, there's not a ton of space for that, but what some people have done, there are some comment boxes we'll see, so you can add it there. Or sometimes people have like a Word document and they'll just pull a couple of quotes and just attach it as a Word document. Obviously, yeah, we'd love to see those things and hear from people in their own words about what they're learning and experiencing with your work.
Cool.
And I know that there's a report and then there's a call. Did I see that there was an option to do a call instead of a written report?
No, they actually work together. So how that came about was initially it was a pretty big report. And when we started hearing from grantees through our calls, they were like, we love talking about this stuff. We don't want to, we reflect so much better. We feel like we provide better information. So we just took a big chunk of the report out and made that the call, and then just really tried to minimize the report piece. So they kind of work together.
Perfect.
Yeah. Okay. And then that last piece that we were talking about, these are care over time's more system stuff. So this is where we're looking for people to have a better net during transitions. So things that we definitely heard from community, though: increased options for crisis and acute care. This is just really important in Denver right now. Well, and has been for a while. So anything we can do to show that we're bolstering what's available is important. If we can show that there's improved coordination, particularly across types and levels of care. So for instance, the criminal justice system is working with our nonprofit providers to provide sober housing when someone leaves the justice system. That's a improved coordination through a transition. Increased retention through those transitions. So someone actually shows up at that sober living facility and makes it through the program, and then has some other housing support moving them through, but through this whole piece that we're providing that mental health and substance misuse care along the way to make sure that they can really sustain their mental health and substance misuse piece. And then the last piece, the stability over time, which is a little bit what I was talking about too, but so for a lot of our grantees, it's that recognition that there's a lot connected to someone maintaining mental health and being able to either be sober or reduce their substance misuse. So we have a lot of grantees that do things related to housing or employment or education. And so this is a place where they can report on those things as a way of helping to support someone with mental health or substance misuse issues. So we just wanted to make sure that contextually we gave space for all those additional things that sometimes are part of the process of dealing with substance misuse and mental health. So any questions about that one?
Is that basically like supporting people who are accessing mental health with other areas like economic opportunities, or including like social opportunities?
Yeah, it can be any of those things, as long as it's in the ultimate goal, the in-service goal for us and for the foundation is that we're working towards that mental health and substance misuse piece. So as long as it's not like, this is the end of the road, we're providing housing, the end. It's like, well, it's housing in support of ensuring this person can maintain their mental health, can stay out of the criminal justice system, can reduce their substance misuse. So as long as it's in service of those final goals, then yeah.
Okay. Thank you.
Great. Erin, did you have any questions?
No, not yet.
Okay, great. So, so that's essentially the model.